Hello, everybody. Welcome. Thank you very much for making the time to come and join the webinar today on Catalyzing Systems Change for Impact at Scale. My name is Emma Colenbrander, and I'm Managing Director at Spring Impact. I'm going to start by giving you a quick overview of who we are at Spring Impact. If you can go to the next slide, please. We are a non-profit working around the world with mission-driven organizations, helping them to achieve impact at scale. And our mission is to scale up solutions successfully and sustainably. So we're here today to talk about systems change. Systems change means many different things to many different people. At Spring Impact, we talk about two pathways to scaling impact. And one is scaling up the impact of solutions, that's the green line you see here, by scaling direct delivery of products and services. And the other pathway is reducing the size of the problem via systems change. That's the pink line that you see here. So we used to see nonprofits focus primarily, if not exclusively, on the green line, focusing on their organizations, scaling up their solutions, scaling up direct delivery. But increasingly, we see nonprofits recognize that impact at scale actually isn't possible without looking across the wider sector and simultaneously trying to decrease the size of the overall problem. And that's why we were so excited at Spring Impact to have the opportunity to dive deeply into one incredibly powerful example of a nonprofit that has increasingly shifted its focus from programmatic work to systems change. And that organization is Ilifa. Ilifa is a nonprofit that works to secure an equal start for all children living in South Africa through universal access to quality early childhood development. Ilifa has played a really essential role in strengthening South Africa's ECD ecosystem and driving progress towards delivering quality ECD services for children. And it's done this in a whole range of ways, but particularly by unlocking public funding for early learning and by reframing provision of early learning programs. So we worked alongside Ilifa and Percept Consulting and co-developed a new case study to highlight the approaches that have made Ilifa's success possible and to draw out key learnings for others who are seeking to affect systems change. And we're really excited to be able to share some of these insights with you today. So without further ado, I'm going to introduce you to the speakers for today's webinar. So first of all, we have Zaheera Mohamed, who is the CEO of Ilifa. We have Dr. Beth Vale from Percept Consulting, and we've got Grace from SmartStart. And SmartStart have been a really essential partner for Ilifa on their journey to drive systems change. So we're going to hear a little bit from Zaheera and from Beth, and then we'll jump into a moderated discussion and a Q&A with the audience. If you have questions, please add them into the Q&A function of the webinar, not into the chat, and we'll address them during the Q&A session. So before we start, it would be good to quickly get a sense of who's in the room today. So if we can, if this works, we're going to launch a very quick poll to let us know who is in the room, if you're from a nonprofit, from government, if you're a funder, if you're from an intermediary or a consultancy, if you're from academia or other. And then we'll share the results of the poll with you in about 5 seconds. Okay. Great. So I think we'll close it out and share there. So we've got 63% of the room, 62% from a nonprofit, and then a nice spread from the funding world, from the intermediary world, and other. Great. Thank you, everyone. That's very helpful. Okay, so I'm going to hand over to Zaheera to tell us a little bit more about Ilifa and the work that Ilifa has done to drive systems change in the ECD system in South Africa. Over to you, Zaheera.
Good afternoon, everyone, and morning for those who are a little bit further afield. I am Zaheera. I'm the CEO of Ilifa Labantwana. I've been with Ilifa Labantwana from the year 2017. Before that, I spent years unlocking public money within the government treasury system and brought a lot of that systems thinking around ECD finance and economics into the organization. I joined a time at Ilifa. It was a very interesting time at Ilifa when I joined. I've known Ilifa for many years, was always very impressed with the work that they do, and had really engaging conversations back in the day, being a government official with an NGO organization around early childhood development systems. And just hearing them and see the journey back in the day to how they started working as an organization by, well, firstly, me sitting within government, seeing work around a national integrated plan for ECD being developed, and sitting within government thinking, but what does it mean and what does it actually look like? We couldn't fathom from government what an integrated ECD system or program would look like. But then there was that said, we're not going to wait to see what this looks like. Let's show government and society what early childhood development looks like in a way that matters, in a way that reaches the most vulnerable children, and shows that the strength of community-based delivery, and to show the vastness of what early childhood development is, and that it does not have to be confined to a perfect infrastructure setting. Let's go out there and show the importance of caregivers. Let's show people that ECD is also about maternal and child health. Let's show the community, let's show government that ECD is also about community-based provision and using the strength of women in the communities. So back then, Ilifa, before I joined, started working with a series of non-profit organizations to develop models of various types of early childhood development programs. Soon after that, we quite realized that we've shown what integrated ECD looks like. We've physically demonstrated what an integrated plan needs to look like, but how can this be taken to scale? How can it roll out? And we as an organization, you from the answer, we cannot do that ourselves. We need to find other ways to be able to make sure that what we've demonstrated is going to take root. And some of that thinking informed the design of partner organizations like SmartStart, where we as Ilifa could say, we don't need to deliver and drive programs, but let's establish a really strong system and platform and partner who we can work with that can continue with the good work of driving the community-based program that we've demonstrated to basically work on the one hand. And on the other side was to say, what do we need to do to make sure that our programs that we've demonstrated get acknowledged, accepted by government, but gets financed and the laws and the policies fit the types of programs that matter for people out there. And that then got us to realize that we've got to work closer with state, because you as a civil society organization cannot scale. We cannot scale without state intervention, and started getting us think very differently about scale, to say, so actually we're not in the business of scale. What we need is a government enabling environment for government to enable the scale of programs rather than be in the model of the business of replicating a series of individual programs. So that's a high-level summary of how we've shifted from program design through to starting thinking through how we need to work with government, number one, and the role of government is actually the enabler for scale.
Fantastic. Thank you very much, Zaheera. That's a really helpful introduction. I'm now going to pass over to Beth, who's got some slides just to share a little bit about the systems change case study and some key highlights, and then its relevance for wider systems change thinking. And then we'll dive into a discussion. Thanks, Beth.
Thanks, Emma. I'll wait for the slides to come up, but just to say that Percept were tasked with developing this case study of Ilifa's work of the past, more than 15 years. It's a mammoth task. It's very difficult to capture everything that they have done, all the partnerships along the way. And so I just wanted to signal for those of you who will hopefully read, and more importantly than read, use and scribble all over and teach with, and whatever it means to take up the case study, what you can expect to find there. So maybe the first thing to say is we developed the case study based on a review of a lot of Ilifa's strategic and internal documents over the years. We interviewed about 20 key informants across the ECD ecosystem, from public sector, government departments, to academic institutions, to a lot of folk working in ECD civil society, and we also embedded ourselves in the systems change literature, and then of course did an analysis of that data and spent a lot of time in collaborative reflection with Ilifa staff over the years. But to signal where the case study focuses, it's really much more focused on the how of what Ilifa has achieved than the what. So we made some quite clear decisions that we were going to focus on 2 of Ilifa's strategic pathways and really get into the nitty-gritty of how it was that Ilifa was able to target systems change levers in that strategic area so that others who are in the systems change space could learn from that. Similarly, while we drew on a lot of input from folks in Ilifa's sphere of influence, each of those partners, and it was kind of amazing to witness, because as you spoke to folk who had worked with Ilifa over the years, some would describe Ilifa as a technical partner, some would describe Ilifa as a huge resource of ECD thinking and evidence. Some would describe Ilifa as an advocate for young children, an advocate for early learning programs. And that was because they were all interfacing with Ilifa at different moments in their journey, but also at different intersections in the system. What reflecting with Ilifa allowed us to do was to get a holistic picture and contextualize those interfaces within Ilifa's strategic journey. I think we can go to next slide, Julia, thanks. So Zaheera gave a really great primer for this, and I'm not going to talk in huge detail, but Ilifa's work is divided into these 4 phases over their years of existence since 2009. As Zaheera mentioned at the start, a lot of the focus was on programmatic demonstration, building implementation evidence around community-based integrated ECD programming. During this period, they were also learning a huge amount about the ecosystem in which these early learning programs at community level are operating, particularly how funding flows. And I think during that phase, what was learned is that if we really want to have a quantum leap for children, which was the language used at the time, actually Ilifa as an organization needed to start becoming a little more savvy politically and engage as a systems actor to help nourish the ecosystem that's going to support this diversity of programmatic models. So in phase 2, you'll see them focusing much more there and partnering a lot with local government to nurture the kind of ecosystem that supports those programs. And then increasingly with the national level government as it becomes more involved in the regulatory space, which was proving to be a big barrier, both to increasing access, to bolstering quality, to bolstering demand. And then most recently, really trying to shift how we think about ECD and positioning it as a human capital lever. And the languaging, there's a bunch of different ways of framing what it is that Ilifa is talking about here, but really what it is about seeing ECD not just actually as a question of children, but as a question of how we really redress systemic inequity in a South African context, how we break cycles of intergenerational poverty at this critical childhood moment. We can go to next slide, Julia. So just a couple of high-level, I suppose, contextual framings for how we approached systems in this work. And the first thing to say is when folks speak about systems change, what we're talking about is systems that have a really high degree of complexity, and the ECD ecosystem is a perfect example of that. There are many actors spreading multiple government departments. There is really rich civil society that includes large NPOs and research and training organizations, all the way to like a very diverse heterogeneous network of micro enterprises run mostly by women in the informal sector. So it's a really complex space that spans multiple sectors. And sometimes it's difficult to even name where the system boundaries are or who the beneficiaries are, because actually there are many beneficiaries in the ECD ecosystem. There's the children themselves, there's the practitioners in the early learning programs, there are the caregivers who stand to benefit enormously from additional support, and we could go on, right? So framing ECD not just for children, but as an employment mechanism, for example, as a place to build robust civil society, as a place to drive gender equity has been a big part of Ilifa's mission, particularly in recent years. So there are many moving parts and interdependencies in the system, and many ways in which these interdependencies create dynamism and constant kind of ambiguity and uncertainty. And part of what a systems change approach means is to embrace that complexity and that emergence, which I think has been key to Ilifa's work, and I'm sure will come up a lot later. Very last slide from us, Julia. Great. So one of the ways in which we tried to visually think about systems change in the case study was through this model that will probably be familiar to many folks on the call, this iceberg model, that really tries to make visible these mental models and underlying structures that produce these inequities that we end up seeing in the system. And in the case study, we isolate, as I said, two of Ilifa's key strategies over the years that have really sought to disrupt these underlying systems within the ECD sector. The first is in how Ilifa has reframed ECD provision. What does ECD provision mean? What does it look like? Zaheera already started speaking a bit to this, like getting outside the idea of a formal center-based, purpose-built center to really kind of allowing for and nourishing a diversity of models, centering the caregiver. I'm sure we'll come back to a lot of this later. And then secondly, the work in unlocking public funding, which has been an absolutely critical lever to alleviating some of those pain points that act as huge barriers, not only for providers who want to open programs, but also for caregivers and children in seeking to access quality programs. So I'll stop there.
Thank you very much, Beth. Okay, so with that framing and context, let's get stuck into it. Zaheera, would love it if you could tell us a little bit more about how you guys concretely have affected systems change and maybe pull out some of your key achievements in recent years.
Sure. So I think if you go high-level achievements, I think Beth has covered it really well. If I must speak to it, would be the fact that, as I say, show me the money, right? And we've been able to do that. We've been able to really unlock ECD money in a time where there's severe fiscal constraints. The other one that Beth mentioned, which I think is absolutely phenomenal, is just shifting the mental models. I think being able to, because that is not only purely a technical exercise, that's shifting deep entrenched values and understanding that people have had of the ECD system. But I think linked to that, and this is something that hopefully Grace will talk to a little bit more, is just I think the one big thing that we've shifted as a collective, not only Ilifa, but Ilifa and our partner SmartStart, is to show the importance of a delivery system. Is how to show that you have a public system when public systems have to work to create an enabling environment, but the critical importance of making sure that the public system lands where it matters, and that is in the hands of women providers, is where an organization like SmartStart has done exceptionally well in establishing that understanding, that that's also an important part of a system. It's not only the public system, but the delivery system is as equal, if not as important, right? In terms of the tactics and strategies and what have we done, I suppose the key thing that you'd hear come up even in Beth's speak is just how we noted for evidence, and a lot of how we and when we say evidence, we don't mean RCTs or big fancy university product. It comes from understanding the system. It's about really understanding what does it take to deliver an ECD, an ECD service. What does ECD mean for people? What does quality look like? And being able to articulate that and articulate it in a way that's accessible and meaningful. And in doing that, we found ourselves bridging what we call bridging the system. We found ourselves being able to articulate to government exactly what matters in terms of quality early childhood development. We were able to, through understanding the system, explain to government, you don't need a brick and mortar structure to deliver early childhood development services. Look at the strength and the value of your assets at a community level that can be run out of a home-based environment that can also deliver quality ECD. So the strategy and tactics around understanding the system and being able to bridge the system, being able to connect government and make them understand the way that ECD actually matters and is delivered at a localized level is a key important methodology in terms of how we work. And in doing so, again, it would have been impossible for us to do that without collaboration, because we learn about what happens at an implementation level through our partnerships with organizations like SmartStart, who are holding the delivery at a cold face. So through partnerships with organizations like SmartStart, we could design an entire legal system for community-based early childhood development systems, which government didn't know how to do. They didn't know how to start dealing with hundreds of informal ECD providers. But through SmartStart's model, we could articulate it and say, government, here they are. They're providing ECD service at community level, and this is a way you can organize lots of informal providers, and this is the associated legal, financing, and administrative systems we can help you put in place to be able to scale up ECD using those types of typologies and modalities. So those are just a few high-level ways in terms of how we've worked here.
That's great, thank you. And what a great segue. Grace, I'd love to hear your reflections on some of what Zaheera shared. It might be helpful for you to give a quick overview of SmartStart and then talk to us about your role in this journey and the role that SmartStart has played.
Thank you, Emma. Good morning, good afternoon, good day, everyone. SmartStart is a delivery platform, really, whose focus is made up of a number of non-governmental organizations, as well as a very powerful network of ECD programs across South Africa. We are focusing on achieving population-level change in access to quality early learning in South Africa. And, as soon as you talk about population-level change, you don't have an option but to approach this as a system. And so we see SmartStart as focusing on building a delivery system for access to quality early learning. SmartStart itself was started in 2015. It was seeded within Ilifa as emerging out of the program that Ilifa ran on playgroups, demonstrating other modalities of reaching unreached communities in pragmatic models that will still achieve quality, but will achieve quality at scale. And so, so that's sort of our genesis. We've grown. And I guess when we entered the fray just at the point that Ilifa was pivoting out of programmatic work into government systems work. In all that time, a big insight on our part is that, those things that hold exclusion of children from quality early learning in particular are really driven out of the environment of poverty. But that even when you're sitting with such really powerful things as poverty and inequality, there really are opportunities. And to use a phrase that Zaheera used, that's a frame mindset of looking at the assets with which you can work right now and still achieve good results, rather than the mindset that says quality can only be achieved with high investments in infrastructure. And there's absolutely nothing wrong with those things. They're all good, and they're also good for a country to aspire to at some point one day in the future. Right now, we're sitting with an important gap, and that is the gap of ensuring that every child has good access to quality early learning, or let's say broadly early childhood development in those first 5 years, when we all know how powerful the opportunity is. And so as SmartStart grew and we were gaining the insights that we are gaining from the field, to the point that Zaheera is making, we started to feel that we really need each other, and that we need Ilifa to see that the vertical systems, state systems that enable ECD have got to be connected very clearly into communities, that those vertical systems are targeting. And I guess SmartStart had to be cognizant of the mechanisms that are required in order to achieve certain shifts within the state. There is a temptation to assume that when things are not achievable within the state, it is because of a lack of will by the state or those who represent the state. And, you know, a very important thing that if I were to credit Ilifa for that happened in SmartStart is realizing that it isn't always lack of will. Sometimes it's just not being able to find, you know, the points of connection between how the state works and how civil society lives and how problems are experienced. And sometimes it's just not having an idea of how things can be done, and that if you focus on demonstrating mechanisms which can be implemented, the state and civil society delivery platforms will be able to find each other. So this has been a partnership of, you know, an evolving partnership, evolved significantly. I really do want to mention some of the key things that feel like they evolved and started to inform very quickly the partnership. I think our mutual insight that evolved during COVID about how big the portion of the ECD sector is operating in the informal economy was a point of pivot for all of us in ensuring that the state also sees that, and that policies, regulations are cognizant of that, and that the mindset models you talk about, Beth, are not about a formal system that can comply very quickly to what government requires in order to make for efficient government systems. And the last mile challenges that are inevitable when the state is far from where the delivery is taking place. And so you can design policies, you can design process, you can have good legislation, but if you have a gap, last mile gaps, none of that will result in children who thrive, as is what South Africa would hope for its children.
Thank you so much, Grace. So both you and Zaheera have spoken a lot about government. This is obviously very core to your systems change work. Zaheera, you spoke about how essential it is to connect government and understand how government works. And Grace, you spoke about how it's not the will of the government that's the problem, it's finding those points of connection. So can you talk a little bit about how you have been so successful in partnering and working with government? We've also had a question come in the Q&A about how you can influence sustainable systems change and work with government even in a highly political environment, a highly volatile political environment. So perhaps you can respond to that question as well at the same time.
Grace, I'll start, and then you can add on. So yeah, working with government first, I suppose it's important to articulate that government is not a monolith. You're going to get parts of government that work really well. You're going to get people with really good attitudes. And it's just a myth that government's lazy. The people that we work with in government are extremely, extremely hardworking. So I suppose our approach to working with government was going in with a lot of empathy. And I think that stood us in good stead. Empathy and humility, and really giving them the benefit of the doubt that they do want, as Grace said, coming from a positionality that they want what's best for children, right? And just meeting them where they are, starting hearing where they are, meeting them where they are, and slowly working with them using evidence, because I suppose that's the other thing that Ilifa always brings, is through working with SmartStart at a practical level, being able to bridge that gap with government and just make them realize the different way of doing something. There's a quicker way, there's an easier way. And I suppose what helped Ilifa in good stead as well is, again, taking the time to understand the system. There was a deep appreciation that we found from government, that we actually took the time to understand their pain points, that we took the time to understand a simple challenge of what it means when you don't have a vehicle as a government official and what that means for you in terms of your day job. So coming in, so it's not only the policy understanding, it's not understanding only the law or the processes, but what does it mean for that government official to do their work? So the deepness of understanding the system and being able to bridge the system are the tools and ways that really helped us get trust. Because I think through that process, we were able to build trust with government. It's been no feat to say that we've gathered trust with everyone. I'm certainly not saying that it's been an easy road. It's probably the hardest part of my team's job is to maintain those relationships with government, to get us at the door and keep us having those conversations is something that none of us take for granted. It's continuous work. And that also means that we've got to be extremely agile. It's not about our idea. It's about what do we need to do for children. And we find that helps us a lot if we frame it not about the solution, but the end point of the fact that we want universal ECD access for all our poor children. And if we frame it around the common need and the common vision that we all want in the ECD space, whether you're government or non-government, it kind of helps guide the conversation. If you go in there gung-ho saying, I've got a solution to your problem, it's going to be really, really difficult for them to engage you or basically open that door. But it's the tricky bit, and this is the last point I just want to make about this. It's a really difficult role to play as a civil society organization, because it's almost an expectation that as civil society, your job is to hold government accountable, and you're a sellout when you're helping government and they're doing so terribly. You've been at this for 20 years, but look at our access level for children, etc., etc. So being able to be very clear on what your mission and your vision is, and being very comfortable working with government, helping them, but being very clear to government that I may be here to support, I may be seen as supporting you, but I'm not actually here to support you. What I'm here to do is make sure we develop a system where children can have universal access. So again, always bringing it down to the big issue. And if you bring it to the big issue at hand, it also takes you out of the politics of it. Who can argue with the fact that all children need universal access to ECD? Nobody can argue with the fact that no child should suffer from malnutrition at the end of the day. So just keeping your vision clear helps get out of the political nitpicky types of environments, and you can use the evidence that you generate to be able to help get you the solutions that you're working on out of those spaces as well. Grace?
Yeah, you've covered so much of what I was going to say. For me, I think really the biggest opportunity is a shared vision for the future. So government, the same as civil society, the same as business, the same as all of us. What we are after is universal coverage of ECD in South Africa. We want all children to thrive. We want all children to have access to quality early learning. We want all caregivers to be supported. We want children to be well fed and thrive in all senses of the word. And so that is a point of departure in any relationship when you realize that you're working on the same things and that the end goal is the same. You're just coming at it from different areas. It's proven to be very powerful in our work with government and with other partners as well, to be quite honest. But as Zaheera says, governments are run by human beings, and relationships matter with human beings when you are striving for change. When you are striving for anything, and relationships that are based on trust. That is not an overnight thing that you build over time through mutual accountability, mutual dependability, and just a sense of needing each other has been really at the foundation of our success with government. SmartStart has come at the work with government much more from, practical demonstration of implementation mechanisms, like systems of implementation that will help us reach all children, and real examples of where government assumed government systems fall short of communities of children that need government services the most. Again, it's not an overnight thing, and it is really held together by like how deeply we buy into the problem rather than how deeply we buy into the solutions we bring. So I would say Ilifa and all the other partners, quick-footedness and responsiveness, really being willing to, I was taught that in order to be successful in social impact work, you start where your client is at. And so not starting at a point of your own assumptions, but starting at the point of where government is, what is their pressures today, how do they feel like they're succeeding today? But also where communities are, where the parents of these children are, what their own challenges are that are creating such a barrier of access for the children, so that the two parts of the ecosystem can connect with each other, much more effectively. I do think that there's a long way to go in, I just don't quite know how to respond to the political will. I mean, we've seen that in South Africa now, we are in our election season, and all of the political parties have ECD as a priority for them. What we really do need to do in our country is really just sort of frame the mindset that see children as if childhood is a permanent state in the first 5 years, and not see it as a powerful opportunity for investment in the future of those human beings will be adults. And there'll be different set of adults based on the investment we make in them today. And that's the mindset shift that I think all of us in this sector still have to achieve, really, not only in government, but in our society.
Thanks, Zaheera. Thanks, Grace. So we've got lots of really good questions coming into the Q&A, so we'll move on to that in a minute. Before we do, I've got one more question for you. We've mostly got an audience of nonprofits here, and the biggest challenge I can imagine for almost every single one of them is going to be funding. Funding is hard to access at the best of times, but it's even harder to access for systems change. So I'd love to hear any advice that you have for nonprofits in the room who are working towards systems change. And also for funders, how can funders enable an environment where systems change is truly possible? And you might all want to comment on this, but I will let you, Zaheera, have first right of response.
Great, thank you. So, yes, so flexible funding, core funding, long-term funding. You cannot do systems change without that type of approach to funding. And we've had a core and also long-term investment by funder. You need a funder that understands what systems change is, and it's hard. It's hard for a funder to get their head around systems change, because you can't get your arms around it. You can't hold it. There's nothing tangible. You can't develop like an easy at your fingertips results-based framework when it comes to it's all soft stuff. I mean, you're gonna have to speak to a funder about things like I spoke here on empathy, and so it's quite hard, right? But I suppose from Ilifa's side, what made things slightly a bit easier for us is that we've got our funder members that have been with us over the long course. They firmly believe in what it is that we are doing, and it's partly our funder base that encourage us to even do the case study, so that other funders can also see the value of what it takes to invest in a systems change organization. There's also the element of trust. If you're going to invest in someone, in an organization that's driving systems change, you're going to have to go in with a lot of trust. You've got to be able to be comfortable with uncertainty. You've got to be comfortable with risk, with the fact that for systems change, there's lots of innovation that you've got to go in there and try. And sometimes you're going to fail. Sometimes you're going to hit the jackpot with your specific systems interventions. And also just understand the systems change journey, that it's not linear. It takes lots of different complex moving parts, and you may start on something, have a deliverable in year 1 that actually you drop in year 2 and 3, and suddenly year 5 is an excellent opportunity, and what you started in year 1 you suddenly pull off your shelf, and there it becomes a new policy or law or systems change. So just the emergence, the uncertainty, it's being comfortable with discomfort, I suppose, is the best way I can explain that we experience, that our core funders seem to handle really well. How to go out and raise additional resources for systems change. If someone else knows that trick, please let me know too, because I don't know. That's why I'm saying we're very fortunate. Our founder funders have been with us and are staying the course. And we still have to put our toe in the water to see how do we start getting other funders who are not traditional systems change funders onto the side of funding systems change, because those that fund us have traditionally always been behind the concept of systems change. So I don't have any tips, unfortunately, yet.
Grace, Beth, would either of you like to add something?
Sure, I'll be super brief because
Yeah.
I think that Zaheera has covered this really well, and I'm sure Grace is going to have a lot more to say. But I think the one thing I just want to emphasize in what Zaheera said is I think that historically, a lot of the ways in which the kind of funding environment has framed impact, its sort of frameworks for impact have created quite a lot of rigidity for those working in NGOs, where they're boxed into a set of commitments and indicators and whatever, and it's very difficult to then move within that and be responsive to the system. And so definitely it needs an approach from funders that, as Zaheera said, is open to that kind of agility, and that in its very nature requires a different way of thinking about impact. How do you see impact in the system, and not necessarily as measurable outcomes, which take a long time often to bear fruit, and especially in a complex system, those impacts sort of flare up in different parts of the system before they galvanize. So there's a lot to say there. And then I think in terms of attracting funding, what Ilifa has demonstrated so well, that's kind of coming back to where we started, I think, is about how you frame the problem. And what Grace said so powerfully, and I think another way of framing it is that given that ECG, for example, so much of it lands in the informal sector, in caregivers' homes, in someone's backyard, I mean, really on underpaid women, most Black women in this country, reframing that as not just being like a private issue that happens there in the informal space, you know, and reframing it as a public good, that therefore we have a responsibility to nurture and support and to kind of break this centuries-old legacy of unpaid burden of care falling on women. I think there's scope to pitch that in a way that a lot of funders care, whether they're like into ECD specifically or not.
Beth, I think that is just such a powerful thing to say, because, you know, I mean, I think, Emma, the opportunities in funding, if I were to draw from SmartStart's own experience, you know, will come from either a new funder in the ECD space, or, you know, just real reframing of the power relationships between funders in ECD and deliverers of programs. There's a massive criticism in the sector that NGOs don't measure impact and so on. And yet, you know, they're dealing with things that don't change in 2 days. And so when you're looking for quick results, you're going to get very shallow quick results. ECD funding should be patient investment. It should be investment that's respectful of how long it takes to shift mindsets. You know, mindsets are held in place by very powerful belief systems. And so they are not things that change overnight. And so we really do want to encourage funders to challenge their own stereotype, you know, stereotypy of the NGO sector. We're not saying we don't want to be criticized if we need, if we need, to up our game a little bit. But poverty is a powerful thing. Patriarchy and gender norms that feel entitled to free childcare by women are powerful, centuries-old things, to the point that Beth is making. If we are looking to make real change, we have to approach it with respect of all the role players, of what they bring, particularly those who are most proximate to the environment we want to invest in, those women who are working in the context of real deprivation and totally underpaid. Anyone who's trying to make, to become rich should not come anywhere near the sector, or they should come on board so that we really do shift the things that need to be shifted, so that this, like any other sector, starts to build itself, that we have a natural workforce that emerges from generations and cohorts of young people choosing to be part of the ECD sector. So that government itself invests as they should in ECD, respecting that is an investment that will not only make sure that children are successful now, but will make for a far more successful country in the future. Ensuring that the business sector, which is such an important partner in investing, particularly in innovations, in testing new ways of coming at the problem, that they come at it also with respect for the NGO sector and with the patient investment, as I said, and making sure that they're in it for the long haul. And all of us learn, use where we don't succeed, we use that not as a failure, but as an opportunity to learn and improve.
Thank you. Coming across very loud and clear the need for the focus on the long term. And there are some real challenges there around how NGOs do measure and talk about the impact that they have. At Spring, we like to talk about the difference between vanity metrics, which is about, the number of people that you're reaching and, the number of events that you've held and so on, and how meaningless those type of metrics actually are, and trying to get funders to think more about more significant metrics around the quality of relationships that are built and the nature and the number of connections that you can forge across an ecosystem. It's really, really hard, but that is very much, I think, where we need to go if we're going to get funders serious about funding for systems change. Yep. So with all that, we've got some really good questions that have come in the Q&A, and we're going to start with this question from Rebecca, which I'm hoping that some of you can see. So the question is how you navigate that transition from delivery mode to systems mode, with social needs feeling so great, carving out space and time to work differently, to look at long-term systems change and long-term impact returns. Can be very hard. She's found this shift difficult. Any tips would be great. Would any of you like to respond to that question?
You want to go at it, Zaheera, or you want me to go?
You could go. From SmartStart, being SmartStart a delivery platform, I think it's more relevant. Yeah.
Well, so for us, it was sort of a slow evolution. We realized as we were working and we were growing, and our approach was to build supply of ECD to close the gap in access. And we realized that actually what holds the supply back is sort of, as I was saying, poverty, because the children who are most excluded are in the poorest communities, and the ECD programs that most struggle to register and therefore get funded by the state are from the poorest communities. And so we then, at the same time, as we continued with our delivery as we were doing, we started to understand the problem deeper, parallel to that. And so, so what we were doing, Rebecca, is use the practical experience of daily delivery to build a system for delivery. We did not change overnight to no longer be a program deliverer. We continue to deliver program, but we don't see ourselves as only a deliverer of programs. We see ourselves as a attempting problem solver, contributing to solving the problem of exclusion of children through delivery mechanisms that enable that, in partnership with other non-governmental organizations and the state. I hope that answers Rebecca's question.
Okay, thank you, Grace. So let's go to the next question, which is from Lydia, which is, how have you managed to build a collective vision in your systems work that NGOs can also work towards? And there's another question that's come in that I think it would be great if you can answer at the same time, which is, the ecosystem, the ECD ecosystem in South Africa has a large number of long-standing impactful organizations. So how do you make sure that you include them and you don't alienate them or compromise their impact, but include them as part of the systems change? Can you respond to that?
I think that this is something that Ilifa has done the best. For SmartStart, it's work in progress. We have organizations that we work with very closely. It's a finite number of organizations. We find each other, we strengthen our relationship, and cooperate with them on specific aspects of the work. I think apart from the work that Ilifa has done on enabling or seeding the establishment of real reform for ECD, which in fact is about how we represent the interests and views of all ECD role players. I think all other work, I mean Zaheera is better positioned to say this. Why I answered this question, I don't know. But all other work, like the work on financing, for example, is informed by many other ecosystem role players in South Africa, and not just the closest partners that Ilifa works with.
Zaheera, Beth, would you like to add anything?
Yeah, just to add a small thing, I suppose from Ilifa side, we don't work for the sake of Ilifa. Nothing we do is for Ilifa. We don't raise money for Ilifa. We do financing work to be able to make sure that the entire ECD ecosystem is funded and is financed. So it's about, and I suppose that's where you must understand what's good to have a good understanding of what it takes to work within a system, what your role is within the system, but by changing and working at a systems level, you're creating an environment where you might not be working with lots and lots of other ECD organizations, but you're working at the level of a system that's going to end up being beneficial to the entire ecosystem, to the 40,000 ECD sites out there, that if we don't work at the systems level, we just have to work and try to develop partnerships with a few organizations, we'll be able to work with maybe 10. So instead of taking that type of strategy, it's systems level work. Let's fix up the funding system and make sure we unlock lots of money that can benefit the entire types of ecosystem. What that basically maybe means is that to be able to unlock government's financing system, it may not allow us to have the skill set or to be able to work with hundreds of ECD organizations. But like Grace said, then we've been able to, we've set up we work with our partner organization, SmartStart and Equality Collective, to set up a movement called the Real Reform Campaign. Because we know as an organization, our strength point is not on mass coalition building or movement building. We've defined the type of system that we want to work in. We're very clear where we're not working in, but we're making sure that our networks, or the way we work with other organizations, allow us to leverage what they're doing. So we support other organizations to be able to bring in and do some of the mobilization work.
Thank you, Zaheera. So we've got time, I think, for one more question. This is one for you, Beth. So there's a question around the extent to which this case study provides new knowledge from the global South or African perspective, or affirms existing knowledge. Can you answer that one?
I mean, it's a great question. I mean, I think I'm always hesitant to say new knowledge, because I think a lot of things are actually known. They are known in an embodied way and have been known in an embodied way for a very long period of time. It's just the extent to which they actually gain traction in dominant sort of scripts. And there's a lot of power involved in what ideas gain traction. But I think that, and we started with this, I think one of the big interventions, and it is a Global South intervention, the Global South literature supports this, is in the reframing of how we think about scale, which is where Zaheera in some ways started, that it's not about putting a model on an industrial line and kind of repeating it times 1,000 or whatever it might be. It's actually about how do you support a really diverse ecosystem, recognize that diversity as a strength, that there is no one model that you then multiply times 1,000, that the diversity is a strength because it's contextually specific and responsive to the needs of children in that context, and then create an ecosystem that can support that that diversity. And I think that some of Ilifa's work around how do we think about what it means. And, there is in the systems change literature, there's this language around scaling deep. Ilifa prefers the language around universalizing. So what does it mean to really think about universalizing access and quality in a way that isn't a kind of traditional scaling model that's dominated a lot of the landscape, and that gets into these deep mental and social and political and economic infrastructures. And then I think there's all the real embedded knowledge of practitioners themselves and caregivers themselves, which I think is, again, not new, but not sufficiently heard.
Thank you very much. So I am conscious that we are at time. I can't tell you how many great questions we've got in the Q&A, so I'm really sorry to have to call it there. But a huge thank you, Zaheera, Beth, Grace, for your insights. That was really fascinating, and a really big thank you to our audience for joining us. We're going to launch a quick poll where you can share how useful or interesting you found this session. We'd love to hear what you have to say. Please do stay in touch with Spring Impact and Percept, and follow the journeys of Ilifa and SmartStart. I think we might have one more slide, yes, which will direct you to where you can find the case study. There's also a link in the chat. Follow us on social media, and you can get your weekly scaling tips via our brand new Scale Mail. So please do sign up. Thank you very much once again, and we look forward to staying in touch with all of you.